Welcome back. Today's lecture will be on autism. Autism is generally categorized in a category of neurological disorders known as ASDs, or Autism Spectrum Disorders. These are disorders of brain development, specifically in social interaction and verbal and nonverbal communication. They occur in 1 out of every 68 children in the United States, with roughly 2 million affected in the US. This is 10 times higher than it was 40 years ago. Some scientists and individuals attribute this increase to an increase in testing and diagnosis, but there does appear to be a genuine increase in incidence of autism in children today, leading some scientists to argue that there must be environmental or other factors contributing to its incidence. Boys are over 4 times more likely to be diagnosed than girls, with 1 out of every 42 boys, but only 1 out of every 189 girls. It is 10 times more common in industrialized countries than in developing countries, increasing by 10% every year. Again, providing support to the idea that the environment plays a role in this disease. Diagnosis usually occurs at the age of 2 or 3. This is when children start to develop communication skills and social behaviors. There is evidence that these individuals are predisposed to autism even before they show signs or symptoms, but that it is not apparent or diagnosable in these individuals until social communication begins. Some signs and symptoms can even be seen before birth, indicating that this disease is already starting to progress even before the baby is out of the womb. Images of fetal brain architecture and overall fetal development can indicate whether or not an individual is predisposed to autism. The mother's immune response may also play a role in altering development of the fetus. This indicates this developmental disorder begins even before birth and continues to progress throughout the child's lifetime. That also indicates that it is not primarily caused by a child's diet, exposure to vaccines, or infections in childhood. Differences in fetal growth and differences at ages 2 or 3 are noticeable, but there are few noticeable differences in infancy. So prior to the age 2 or 3, there's not a lot of indication whether or not that child will have ASD or not. However, at age 2 or 3, there is a noticeable lack of eye contact. The child is not generally responsive to his or her name. They engage in repetitive behaviors like stacking or aligning objects. Some repetitive behaviors even cause injuries, like banging the head or poking him or herself. They also generally prefer to play alone and fail to respond appropriately to the emotions of others. Symptoms continue throughout the life of the individual. Adults with autism have a hard time reading body language. They engage in repetitive behavior and often have poor motor skills. They frequently have intellectual disabilities and find it difficult to control their emotions, finding communication and language challenging. It is generally a rule that these individuals do have intellectual disabilities, as I mentioned. However, there are some individuals that are savants and especially talented in specific areas, such as music, mathematics, art, or others. Secondary issues also form in autistic individuals. These are not a result of being autistic, but instead are a consequence of some of the effects of the neurological disorder. This can include sleep disorders, partly because the brain cannot produce melatonin properly, digestive system concerns, either constipation or diarrhea, leading many individuals to notice that those with ASD can benefit from special diets like a gluten-free diet. Seizures are not uncommon in individuals with ASD. They also generally have stimulus dysfunction, detecting normal stimuli as painful or uncomfortable. So many of these individuals may find themselves unable to wear Halloween costumes or scratchy woolly jackets. They also engage in pica, which is eating things that are not edible, such as dirt, chalk, or paint chips. Lastly, they generally suffer from depression and or anxiety, partly because of their inability to engage well with others socially. Adult brain images show no clear distinction between individuals with and without ASD. The autistic female brain, however, does appear to have some masculine traits. But generally, there's no other gross or large-scale anatomical differences. At the cellular level, however, there are some differences between individuals with ASD and those without. Individuals with ASD generally tend to have too many neurons that are formed in some area of the brain and too few neurons in others. However, it's at the molecular level where the differences between those with ASD and those without really come to light. Some research shows differences in neurotransmitters and receptors in the two different brain types. These include changes in oxytocin, vasopressin, and GABA. Oxytocin is a hormone, a neurotransmitter, sometimes commonly referred to as the cuddle hormone, also occasionally referred to as the orgasm hormone or the trusting hormone. That's because oxytocin is involved in forming bonds and generating trust and connections between family members, friends, and romantic partners. A nasal spray of oxytocin to a person with ASD can alleviate some symptoms of social anxiety. Vasopressin is also used in pair bonding, particularly with romantic partners. This was discussed earlier in this semester with regards to monogamy. GABA, a third neurotransmitter, is also a very important neurotransmitter in those with ASD. GABA is a different neurotransmitter in that it is an inhibitory neurotransmitter, slowing the transmission of signals between neurons. In those with autism, GABA is actually reduced. This results in overstimulation of the brain, leading to oversensitivity of the senses, particularly an oversensitivity to senses of touch, loud noises, and possibly even vision or sight, especially as it relates to seeing a person's face or emotional status. There is debate about what causes autism. Some causes are supported by scientific research, but many ideas as to the causes of autism have no basis in scientific evidence. Many people just promote personal opinions, such as that involved with changes in diet, disease transmission, or even vaccines. The connection between these environmental factors and the formation of autism is made exclusively because that is when autism is diagnosed, is around ages 2 or 3, when the symptoms begin to be noticeable by adults. Unfounded fears of autism being caused by diet, infectious disease, or vaccines has led to many parents altering their behaviors with their children, sometimes in a very unhealthy way, especially as that pertains to the reduced rates of vaccine use that we see in the United States and other industrialized countries today. However, though we've seen vaccine rates drop precipitously in the last 10 to 20 years, autism rates continue to rise, providing proof that in fact vaccines have no connection to autism at all. This unfortunately has also led to the rise in deaths in children from vaccine preventable diseases, such as whooping cough, measles, and others. So if we know that vaccines, diet, and disease are not implicated in autism, what scientific evidence do we have of the causes of autism?
Well, one of the most predominant scientific evidence that we have is that there is a genetic predisposition to autism. ASD is the most heritable form of neurological diseases, in fact, even more so than schizophrenia, Alzheimer's, and some others you may have heard of. Identical twin studies, where two individuals share exactly the same DNA, have shed light on this. If one twin has ASD, there is a 70% chance of the other twin also having that disorder. This indicates that there is a strong genetic basis for ASD, but it is not the exclusive cause of this disorder. Since it is not 100% concurrence, there are other causes as well, though it's clear with 70% concurrence that there's a strong input of genetics and that genes play an important role. The genes affected in those with ASD, however, are highly variable, and this is part of the difficulty with ASD, is that it is a spectrum disorder, and so there are many different symptoms and many different causes of this disorder. This makes prediction of those with ASD or those that will develop ASD very difficult. Autism likely develops from spontaneous mutations, but also from a different type of genetics that's only recently been understood, a type of genetics called epigenetics. Epigenetics is when there are heritable changes to the structure but not the sequence of DNA. Usually when people have their DNA analyzed, especially through Ancestry.com, 23andMe, or at a hospital looking for genetic disorders, they analyze DNA sequences. It's only recently that scientists are starting to investigate other heritable differences in DNA, not at the sequence level, but in fact in DNA structure. Epigenetics usually involves the addition of a methyl group. Pictured here, the methyl group is comprised of a single carbon atom shown in dark gray and 3 hydrogen atoms shown in white. It's the addition of these 4 simple atoms to the backbone of DNA that can cause DNA to have a different structure and thus a different function inside the cell. The methyl groups alter how much the cell uses those genes, with more methylation resulting in less gene expression, or a dormant section of the DNA. Older men, it turns out, have more methylation on the DNA of their sperm than younger men. This increase in methylation is associated with an increase in autism rates in their offspring. Older men are more likely to have children with autism than younger men. This predisposition can be carried through the generations. So an older man having children will also have an increased risk of having autistic grandchildren as well. This is partly, possibly, why industrialized countries have seen an increased incidence of autism, in that in industrialized countries, men are more likely to delay childbearing and only have children much later on in life, whereas in developing countries, men continue to have children much earlier on in life, in their late teens and early 20s. Another possibility for the cause of ASD is maternal illness during pregnancy. Viral infections in the mother, such as having the flu while pregnant, are associated, though possibly not causal relationship, with having a child with autism. This is not the first time that viral diseases or other infectious diseases could lead to neurological disorders, as schizophrenia and other neurological disorders are known to also have a similar cause. Autism is also associated with childbirth difficulties, especially if there is oxygen deprivation of the baby as he or she is being born as a result of difficult delivery. Obesity and diabetes also increase the risk of having a child with ASD, but interestingly, smoking does not have any effect. Recently, evidence indicates that having too much folic acid, especially the type taken in prenatal vitamins, and also an abundance of ultrasounds, imaging of the fetus, could also increase the risk of having a child with ASD.